Today we are sharing an update about a very special newborn baby who surprised everyone in the hospital. This baby weighed an incredible 5.3 kilograms at birth, which is much bigger than the average newborn baby. Usually, most newborn babies weigh between 2.5 kilograms to 3.5 kilograms, but this baby was much larger. When the baby was delivered in the operation theater, the doctors, nurses, and NICU staff were all surprised to see such a big newborn. Because of the large birth weight, the baby was shifted to the NICU for observation and monitoring to make sure everything was normal and safe. Now this is the Day 2 update, and we are happy to share that the baby is stable and doing well. Right after delivery, the baby cried well, which is a very good sign for any newborn. Crying immediately after birth usually indicates that the baby's lungs are working properly. However, because the baby weighed 5.3 kilograms, the doctors decided to monitor the baby carefully in the NICU. Large babies like this are medically called macrosomic babies, and sometimes they can develop certain conditions after birth such as low blood sugar, hypoglycemia, breathing difficulty, birth injuries, feeding problems. That is why the NICU team decided to keep the baby under close observation. When the baby arrived in the NICU, the medical team quickly checked the baby's vital signs. They monitored heart rate, breathing rate, oxygen saturation, body temperature, blood sugar level. Everything was checked carefully. The baby was placed under observation and the doctors performed routine tests to ensure that everything was normal. Because large babies can sometimes develop low blood sugar, the doctors checked the baby's glucose level several times. Fortunately, the baby responded very well. During the first day, the NICU staff carefully monitored the baby. The baby remained active and responsive. The baby's breathing was normal and oxygen levels were stable. The baby also started feeding well, which is one of the most important signs that a newborn is healthy. Feeding is extremely important because it helps maintain stable blood sugar levels. The doctors and nurses continued to observe the baby throughout the night to ensure there were no complications. Thankfully, everything remained stable. Now we are on Day 2, and the news is very positive. The baby is stable, active, and feeding well. All vital signs are within the normal range. The baby's breathing is comfortable and there are no signs of distress. The blood sugar levels have also remained normal, which is very important for large babies. The NICU doctors examined the baby again today and confirmed that the baby is progressing very well. The baby is moving arms and legs normally and responding well to touch and stimulation. This shows that the baby's neurological condition is also normal. A full physical examination was performed again on Day 2. The doctors checked baby's reflexes, muscle tone, skin color, breathing pattern, feeding ability. All findings were normal. Despite being a very large newborn, the baby is clinically stable and healthy. The baby's skin color is pink, which indicates good oxygenation and circulation. The baby is also maintaining normal body temperature. One of the most important things doctors watch in newborn babies is feeding. A baby who feeds well usually recovers faster and stays healthy. This baby has started feeding properly and shows good sucking reflex. The baby is able to tolerate feeds without vomiting or discomfort. Good feeding is also helping maintain stable blood sugar levels, which is especially important for babies with high birth weight. Even though the baby is stable, the NICU team continued monitoring carefully. This is a standard protocol for newborns who have unusual conditions like very high birth weight. Doctors monitored blood sugar levels, body temperature, oxygen saturation, feeding tolerance. Everything has remained normal so far. The nurses are also providing routine newborn care and ensuring that the baby stays comfortable. Many people ask why some babies are born very large. There can be several reasons for this, including maternal diabetes, gestational diabetes mellitus, genetic factors, excessive weight gain during pregnancy, a longer pregnancy duration. In some cases, mothers with diabetes during pregnancy can deliver larger babies. However, each case is different, and doctors carefully evaluate both the mother and baby. The baby's family was initially very surprised when they heard the weight of the newborn. A 5.3 kilograms newborn baby is not something doctors see every day. But now the family is very happy and relieved because the baby is stable and doing well. Seeing the baby active and feeding normally has given everyone great confidence and happiness. After evaluating the baby again on day 2, the doctors are satisfied with the progress. All clinical parameters are stable, and the baby shows no signs of complications. Because of this positive progress, the doctors are now planning the discharge, DC, soon. This means the baby may go home with the family if everything remains stable. The baby continues to feed well and all vital signs remain normal. The doctors will allow discharge very soon. Before discharge, the doctors will provide guidance to the family about newborn care. Parents will be advised about
Prope-feeding,
keeping the baby warm, monitoring the baby's activity, recognizing warning signs. Regular follow-up with the pediatrician will also be recommended.